Welcome back to Healthcare Consumerism Radio. And for this segment, we're happy to have the General Manager from Healthsparq, Torben Nielsen, on the program with us today. Good morning, Torben.
Good morning. How are you?
Oh, doing well. So you're joining us from Seattle?
I'm actually based in Portland, Oregon. This is where we're headquartered.
Okay, great. Well, thanks for joining us. And as we kind of go get it started with this segment, kind of tell us a little bit about Healthsparq. You guys are in the fast-moving world of healthcare transparency, correct?
Yeah, that's right. Healthsparq is an interesting new startup to this space, at least as a brand. We've been, branded Healthsparq for the past 6 to 8 months, I believe, but have been working on consumer transparency tools for the past 5 to 7 years. We came out of Regions Blue Cross Blue Shield, and so have been working on transparency tools for the past 5 to 7 years, really serving our members, 2.2 million members. And because of a interest by some of the other Blue Cross Blue Shield plans, we decided just about a year ago to give this a shot and create this standalone company.
Now, healthcare transparency, big buzzword out there. Why do you think it's getting all the attention and traction currently in the market?
Yeah, that's a good question. We think there's a number of different factors causing that. I think the latest stat I heard was 59% of all employers are now offering consumer-directed health plans. Mm-hmm. Obviously, with that comes a need to really provide tool sets for the individual employee to better navigate the system and make smart decisions around healthcare choices. And so that's one of the factors. I think we're also seeing healthcare reform is putting more emphasis on retail and on consumerism. And we actually are starting to feel this need from consumers themselves. They're starting to ask, when I go to Amazon, I can look up prices and I can look up quality. I can look up reviews. I can, when I book a trip, I have all this information at my disposal. Why do I not have this in healthcare? We think there's a big market need for providing these integrated solutions.
So where are you getting your information from? Is there a database you have? Do you draw it in? Is it real time? How do people get a comfort level that what you're providing is accurate, real-time information?
Yeah, that's another good question. We work very heavily with the health plans, and so we sell into health plans, and today have between 15 and 20 health plans signed up for any one of our products, and we digest and consume all their claims data and do heavy analysis on the back end to really spit out very precise prices for various treatments. Today, over 400 different treatments or treatment options, and relating it personally to the individual member so they can see what the out-of-pocket cost is. And that's obviously what they're interested in.
So you're working out of Portland, working with Regions Health up in that geography. Is there a geographical focus of your business right now as you begin to expand maybe across the country, or are there pockets around the country where you're working with other insurers or other Blues programs?
Yeah. We've actually found that there's a market nationwide for our services. So as I mentioned, we have 15 plans, blue, non-blue plans signed up today, and we are implementing with many of them as we speak. We are serving a total of, if you add up all the membership, close to 30 million Americans have access to these, award-winning transparency tools.
So as a consumer, what would I get so our listeners out there might understand the uniqueness of what you're providing? Which, by the way, I might add, I don't use the term transparency in the work that I do around consumerism. I think it's a good word. It's a little bit of a buzzword, as was mentioned. I prefer to think of it as the right to know. Because transparency, people could say, well, that's proprietary. You don't really need to give consumers that. But consumers really have the right to know what the costs and quality are. But
yes, and that's very much in alignment with our mission. We want to empower the consumer, so you're not that passive, just insurance card holder, being told where to go. But you feel you are empowered to actually look up this information prior to going to your doctor, and you can be informed and have a really informed conversation about what your options and choices are. And so in terms of what we offer, we have a nationwide, really sophisticated directory of providers in hospitals, where you can look up reviews of providers in hospitals. You can look up cost estimates for procedures and treatments. You can provide your own reviews as well, and you can actually participate in a what we call an online community where you can talk about your experience with other like-minded patients or members.
I think, Torben, and one of the questions that I have is a lot of employers, they have a lot of different pain points and they got a lot of stuff coming at them right now. What they do understand is that if I'm going to have a truly healthcare consumerism type benefit plan, transparency has to be a part of that. What is the value for an employer to turn to his or her health plan and say, hey guys, are we looking at a transparency solution, or do you have a transparency solution?
Yeah. For the employer, I think the tool sets that we provide, along with the engagement strategies and collateral that we provide, we believe that we can change the behavior of their employees and over time save costs for the employer. And we've actually seen that. So we have surveys, as I mentioned, we've done this for 7 years. And so we've surveyed and we've looked at, Regence Blue Cross Blue Shield, and we know that of the people that utilize the treatment cost estimator, that is one of our products, up to a third actually change their provider choice based on the information that they find. We also recently did a study where we looked at the web behavior of users of our tools and non-users of our tools, and we compared that to claims utilization. And we found that the people that really utilize, so more scientific study, not just a survey, but actually looking at data. And we found that for people that utilize our tools, for instance, for women's health, in women's health, they are much more likely to choose, and this is just one of the areas you can save costs, is to choose surgical centers over inpatient hospital settings. Mm-hmm. And you can get the exact same quality of care.
So what other sources of data or surveys or research are you doing? Because claims data can be limiting. Maybe you all have found a magic bullet to pull out of claims data as much as you can. That is historical and is generally, developed only to establish a payment between the insurance company and the provider. So are there multiple sources of data that you're mining to generate this information, and what might they be?
Yeah, we receive data from multiple sources. Many of those sources are from the health plan itself that we're selling to, but we augment with national quality data. We have, as I mentioned, website data that allows for certain personalization that really drives engagement. And we combine all that in a very sophisticated data model that we run on the back end, and we see that really creates not just a really good superior experience for the individual, but it actually starts changing the way the member or the patient feels in the system. They feel a lot more empowered.
Well, you're working on leading edge. This is an area I know that there are a lot of companies out there trying to create some quality information out of various databases and trying to get into this transparency. You cannot have a consumer market without good information. The consumer can't make choices unless they have information. So just empowering them financially doesn't do any good, which is why the Institute says those are the two key pillars, information and financial. So as this market is developing, what have you found have been some of the more difficult hurdles to get through? Has it been competition? Has it been that the insurance companies would like to do it more in-house? Or sounds like you've been able to get them to outsource it to you in many ways.
Yeah, we have actually found that the insurance companies have been great partners, and they really have embraced our tool sets and where we're coming from. We like to see them as close collaborators in order to provide solutions that really meet and exceed their members' expectations. I think one of the areas that we're focusing on heavily, along with our clients or customers, is just the awareness that these tools are available. To a lot of, if you ask a man on the street, right, they would have very little knowledge that, this information is starting to be available. Mm-hmm. You can start acting as a consumer in a system that typically has been very complex and where you never knew what it was going to cost you until after the fact. We are starting to see that we can change as long as we provide the awareness.
So, do you have any tools yet that are where are they available? The information is it just on your PC? Do you have any mobile apps? How available is the information these days, and where might you be going to be sure that it is as available as possible?
Yeah, so we've been selling through the health plans, and so our tools are available on the health plans member websites. Mm-hmm. So when you log in, you get access to that information, and we do that because it's a much more personalized information. We can use some of the data that the health plan is providing to really engage the individual member in the options or choices they have. We are doing mobile at the same time that we are developing, so that's always part of our development efforts is mobile web-optimized solutions. And I think, if you look at our roadmap and looking a little bit ahead, it's probably not unlikely that we'll, start having solutions targeting the individual consumer, directly, so versus going through the plan website.
Torben, one thing we like to always get from our guests is kind of where do you see the market over the next, let's say, 6 to 18 months? We've got the healthcare law out there and a lot of moving parts. Where do you kind of see the market between now and, let's say, this time next year moving?
Yeah, I think we are seeing right now just an explosion. I think you mentioned transparency is kind of the buzzword, but there is a lot of focus on that. I think we'll see, more employers really starting to offer these types of tool sets to their employees. I think we'll see health plans be much more aggressive in terms of adopting these tools. And I think we'll start seeing, and we're already feeling this, consumers actually asking for this information and demanding that they have, the same options in the healthcare system that they do when they look up trips or when they buy houses or that same powerful, information or data set available to them.
What kind of quality information is available, and where do you get it from?
We have various quality sources that we are utilizing from, Leapfrog to collaboratives, state-run collaboratives to JCO to, other types of quality data. We also rely, as I mentioned, on patients, members reviewing and providing some of that information themselves. How was the experience with that particular provider or hospital system?
Very good.
Now, Torben, we got about a minute left here. Kind of give our audience, a couple clear takeaways for them to kind of think through and let them know how they can find you as well.
Yeah, so they can go to Healthsparq.com. Healthsparq is with a Q at the end, .com. We have all the information on our website. We're also going to be at the IHC conference, obviously, and at AHIP, and we are very active on Twitter as well, so follow us on tweets. Well,
we want to thank you so much for joining us, Torben. As Torben mentioned, they will be at IHC Forum East here in Atlanta, and they will actually be conducting a table topic discussion on healthcare transparency. So make sure you show up and attend their table topic, and stay tuned for our next segment of HealthCare Consumerism Radio.
This is Ron Bachman, Chairman of the Editorial Advisory Board for the Institute for HealthCare Consumerism. The IHC is a collaborative community for innovative health and benefit management solutions. If you're